Not all Minnesotans are able to get their hands on a flu shot, according to a U.S. Senator Amy Klobuchar. She says some communities don't have enough doses of the flu vaccine, especially in the rural areas. The Minnesota Democrat is calling on Centers for Disease Control and Prevention to address the temporary vaccine shortages. She says if you can find the vaccine, get it as soon as you can.
If you don't get the flu vaccine and you get the flu, we know there are less hospital beds right now. You don't want to start getting symptoms of flu and not know if you have coronavirus or the flu. It's just a mess.
CDC is recommending getting the flu vaccine by the end of October. Meanwhile, a major development in the race for the coronavirus vaccine is Moderna today saying testing shows its vaccine is more than 94% effective against COVID-19. The company plans to apply for emergency use authorization from the government after it gathers more safety data this month. Moderna expects to have 20 million doses ready to ship by the end of the year. It also says it's on track to produce up to 1 billion doses in 2021. One of the nation's emerging health leaders in the fight against COVID-19 is teaming up with one of Minnesota's biggest foundations for an ambitious goal. Dr. Michael Osterholm partnered with the St. Paul and Minnesota Foundation to try to support the families of every healthcare worker who has died from the virus. Best estimation right now says that there are 1,400 healthcare workers who died of COVID-19. At the bare minimum, this grant hopes to give every family $10,000. If you do the math, the Frontline Families Fund would need to raise at least $14 million to fulfill its goal. And Dr. Osterholm emphasizes this virus has stretched everyone on the front lines thin.
I just encourage everyone to be generous. At this time, when it is hard, when it's painful, when it's tough, if you have the means to help, please do.
Aims to help the affected families in 3 areas. The first is immediate needs such as funeral costs and medical bills. The second is a long-term health for socioeconomic setbacks associated with the pandemic. And the third is for scholarships for the children that are being impacted. How has the pandemic changed your holiday plans? Well, next on Valley News Live at 6, ways to budget your gift giving this year.